Airlink Dispatch. This is Rocky.
Seconds count when a critically ill or injured patient needs specialized medical attention.
We've got a mid-30s-year-old female pinned by a piece of farming equipment. They're in an extrication process at this time.
Airlink has played a critical role in Central and Eastern Oregon's emergency medical response network since 1985, partnering with local EMS agencies and hospitals to provide immediate on-scene helicopter response and inter-facility transports. In a business where flight crews, medical staff, and EMS agencies are put at risk every day, safety will always be our first and foremost priority. Using a helicopter or fixed-wing aircraft requires planning to ensure the safety of the patient, Airlink crew, and EMS providers managing the scene on the ground. This includes preparation for arrival, ground operations, departures. When preparing for the aircraft, important areas of consideration include the initial notification for the need of Airlink services and the selection and setup of the landing zone. Notification is usually the responsibility of the EMS provider or law enforcement agency. Activation of Airlink should be considered any time EMS or law enforcement personnel believe there are indications for rapid transport. Airlink encourages the use of its standby process for any situation that may warrant critical care air transport. This means the Airlink team is ready and waiting to launch, which can save valuable time if in fact the flight crew's help is needed. Weather conditions are factored into Airlink's decision to launch. Pilots must take into consideration weather conditions for the entire route of flight to determine if the entire mission can be accomplished safely. Temperature and altitude are also critical factors in determining whether an LZ is suitable. Upon confirmation that critical care transport services are needed, Airlink will launch and call dispatch with an estimated time of arrival, which will then be communicated to the requesting agency.
Souls on board, 120 the gas. We've got about probably 3 minutes to get there.
By this time, the requesting agency should have provided the communication center with all of the information needed, including caller's name, location, return phone number, scene location, geographic position, GPS coordinates or township or range, approximate nature of injuries and patient weight when possible, radio frequency to communicate with Incident Command or LZ coordinator, current weather, snow, rain, lightning nearby, clouds, fog, wind, etc. Report LZ surface, gravel, grass, snow, etc., and its relation to significant geographical features or major roads. Preparation for the arrival of the helicopter includes the establishment of a safe LZ. Critical to the setup is the designation of a trained LZ coordinator who has the authority and responsibility to oversee and instruct operations of all ground crews. The LZ coordinator should be solely responsible for communications with the helicopter during its arrival and departure. The designated LZ coordinator should identify a safe landing zone for the aircraft. A safe landing zone should be a large, open area that is a minimum of 100 feet by 100 feet and is no more than a 5-degree slope. Good options include fields, roads, or parking lots. It must be free and clear of potential hazards, such as electrical wires, signs, stumps, tall grass, antennas, snowbanks, trees, as well as smoke and hazardous materials. It must be inspected. Any debris must be removed, including large branches, trash, and other materials that could be swept up when the helicopter lands. Snow and dust can cause dangerous whiteout or brownout conditions for the helicopter as it arrives and takes off. When necessary, pack down or spray the LZ with water to minimize this risk, or select another landing zone. When possible, emergency vehicles should be positioned at the edge of the landing zone to help mark its location for the helicopter. Vehicles involved with the landing helicopter need to be 100 feet away from the landing zone. All other vehicles should be at least 200 feet back. The patient should also be placed in a safe area where he or she will not be affected by the strong rotor wash or any loose debris. Communication should be avoided unless responding to a pilot's request or if a dangerous situation is developing while the helicopter is landing. All of these considerations apply to night LZs as well. In addition, vehicles should be faced into the LZ with hazard flashers and headlights on low beams to illuminate the area. A few minutes out from the LZ, the pilot will request a briefing from the LZ coordinator. A good report will include the size, a good description of the LZ surface, including snow or dust, any sloping terrain, wind direction, speed, and all hazards. When the helicopter arrives at the scene, the pilot will circle the LZ to conduct a pre-landing safety inspection. All personnel should be outside of the perimeter of the LZ, and all vehicles and emergency supplies should be secure. This could include loose articles such as clothing, hats, blankets, and medical supplies. The patient should also be placed in a safe area where he or she will not be affected by the strong rotor wash or any loose debris. Communication should be avoided unless responding to a pilot's request or if a dangerous situation is developing while the helicopter is landing. As the helicopter approaches, ground crews should remain at least 200 feet away from the helicopter and direct their attention to the LZ perimeter to maintain security. Spotlights should not be aimed at the helicopter as this could blind the pilot. It is, however, helpful to shine lights on power poles and other potential hazards. After the helicopter has shut down, the medical crew will exit. Upon exiting, they will proceed to the location of the patient. Ground crews should not approach the helicopter after landing. Once reaching the patient, the flight team will assess and prepare that patient for flight. Some ground crew personnel may be designated by the flight team to assist them with moving the patient to the helicopter. Under the direction of the flight team, the patient will then be loaded onto the aircraft via the rear clamshell doors. The flight team will take responsibility for securing the patient and closing up the aircraft. Once the patient has been safely loaded onto the aircraft, all assisting ground personnel should move at least 200 feet away, clear of the helicopter's liftoff path, and once again secure their vehicles and equipment. The assisting ground crew should always exit toward the front of the helicopter. Even though Airlink's airplane is met and loaded under the controlled environment of an airport, certain safety criteria must be followed to protect our patients, crew, and EMS partners. Wait until the engines have completely shut down. When you approach, turn off your flashing lights and use only running and clearance lights. Do not enter the danger zone until contacted by the medical crew or pilot. The Airlink team will have you move the ambulance if necessary. Never back the ambulance up toward the aircraft. The ambulance should never be within 25 feet of the aircraft. Loading your patient. Never walk in front of the airplane wing. Let the Airlink crew open and close the aircraft doors. If at all possible, Airlink suggests utilizing a two-person ambulance crew to assist patient loading and unloading to avoid backstrain. While loading the patient, if possible, please turn off the engine to avoid exhaust fumes entering the aircraft, affecting patient condition. You may be asked to assist in loading the patient. Wait for specific directions from the crew. Be sure to ask the crew members about any directions you do not understand. Clear the airplane as soon as your patient is loaded. Please do not leave the airport area until the aircraft has lifted. This is especially helpful if patient condition changes or mechanical issues arise. If there are hazards on the runway, such as wildlife or debris, please alert Airlink dispatch immediately. While the aircraft is in motion, please turn off all bright flashing lights and strobes. During all LZ operations, the LZ coordinator must enforce strict traffic control around the aircraft. Common security problems experienced by the crews include family members at the scene and onlookers who do not respect the LZ perimeter. In a business where flight crews, medical staff, and EMS agencies are put at risk every day, safety will always be our first and foremost priority. By following the guidelines outlined in this video, you can be most effective at minimizing the risks and hazards at the LZ. Thank you for your interest in ensuring safe flight operations for Airlink. We recognize the important role you play in the circle of care. You initiate the care for the patient, select a safe LZ for the helicopter, and enable us to provide rapid and safe transport. We look forward to the opportunity to work in partnership with you to provide safe and effective care.